Today we have Dr. Ananth Bhandary with us, who is the head of the Department of Ophthalmology at the Ramaiah Memorial Hospital. We talk about all things related to myopia, eye health in diabetics, hypertension, and a lot more to do with busting the myths around the health of our vital sensory organs, the eye. Good morning, sir.
Morning.
Thank you, Dr. Anand, sir, for actually joining us on
It's a
this
pleasure.
podcast. And today, I think we'll be talking a lot about eye health.
Yeah.
Most people ignore their eyes, I feel, because it is something that is so vital to us, but most people do not take enough care, if I were to put it. Right from childhood onwards till the time we die, it's one of the most vital organs, right? If I were to say that, what are some of the things that most people ignore about their eye health?
Starting from childhood only, um, the school going age, the lot of trauma which I used to happen. Now I see a little less. I think the teachers are doing a good job. Otherwise, pencil and pen are the most dangerous things where children try to play with each other and have a corneal injuries, which is sometimes, if it is severe, becomes permanent loss of vision for rest of the life unless there is keratoplasty or eye transplant done at the correct time. Other than that, the refractive error. The refractive error, when we talk about in children, there's a big myth that glasses makes more power, and yearly the glasses has to be changed. The power increases, doesn't decrease.
Yeah.
So the glass increase or decrease is nothing to do with the glasses what you're wearing. The power increase or decrease is not
Yeah.
related. It is only related to the growth of the child, because most of them are myopes, and the eyeball grows, the axial length grows, and that's why the myopia happens. And wearing glass at the appropriate age is the most important. That's why we have school screening camps now, eye screening, to find out grossly in a camp which child has to go for further evaluation.
Right. So now that you said school screening camps and glasses for children, no, a lot of parents now maybe they have some education, but earlier they would be like, "Oh, you're seeing excess TV, no? That's why you're having this." Is that true?
100%. Now it's gone to the cell phone. They only give the children the cell phone, and then they blame the child for seeing the. Because that COVID part of it, every child had a cell phone because their schools and classes were happening on the phone, and that started continuing in the house. Also, when they come back from school, cell phone limitation is a must. But now there are no proven things that cell phone causes myopia or any refractive error, not yet. But definitely the light and if the ambient light is dark, if you're doing it for a long time, your convergent muscles are acting more, and that causes a lot of strain. And with the refractive error which is not corrected, it becomes even more problem, and the child goes in for fatigue, headache in the evenings. So most of these children come home with the headaches. Mostly first thing what we think about is hypoglycemia. Sometimes they don't eat the tiffin and they become hypoglycemic in the evening. The second most important is refractive error. And the child's teacher only will call the parent in a meeting and tell them when they are meeting that the child might go for a eye checkup, because the child, when sitting back of the class, they can't write what is written on the board, and most of their back pages are filled more because of their own diagrams or whatever. When they can't see and disinterested and can't see, they start doing their own poetry or diagrams or some of the class. So if you see the back pages more getting filled up early, that means is one of the things is the child is not seeing properly from the later part of the room. So very important. The teachers are they have already been told, and a lot of knowledge has gone through, and so they tell, and the screening camps have also helped our children to come at the correct time. Because if you don't correct after 14, it becomes a lazy eye. And mostly we see a lot of people take it for granted that they even if they don't wear, nothing happens, and the stigma of wearing a glass, and to a girl child wearing a glass is like a huge stigma, even in a very educated society. So I seen parents crying as soon as I say that they have and it is a must to wear this before 14 age group if they have found, because unless you treat them now, the laziness of the nerve cannot be treated later, because the nerve is set for what it sees every day. You can't suddenly put a child and say, ask them to read 6 who's not read the first line itself. So earlier rehabbing with the glasses, not only one glass. And I've seen parents not bringing them for 2 years, 3 years, saying that they are going for coaching class or 10th and 11th, sir, how can they are. This eye is the most important thing for reading also.
Yeah.
They will improvise the read. We have seen people who have not seen the board given glasses. In 6 months, they pick up so much and sometimes stop the class also. Because of their inability to see, they stop
Yeah.
getting concentration and they stop reading for the class. So that happens, and it's not only for education, but the amblyopia part, the laziness of the nerve, what we call it as, if it is not corrected at the correct time with refractive error and monitored every year. Now we call them for 10 months one. The first time we call them little early, we don't know when it is going to change. But whenever it changes, we have to give a new glass and they have to wear it. It's a full-fledged, it has to cover the whole. Sometimes I've seen children wearing glasses but looking through without the glass. So this has to cover, and there are some few tips what we tell the parents. And timing of the gadget, your electronic gadget, is a must for a child at least, because we promote two, three things, new things have come in treatment of myopia, like sunlight, which is producing dopamine in our body, and that helps in reducing the progression of myopia. I'm not saying it is like laser surgery, which reduces completely. So you be in the sunlight, you get emetropia or normal vision. That is not the case, but dopamine production and exercise outside in the evening at least for an hour. Now I make it a point to tell all the parents who bring the children at least 1 hour a day they have to be outside and off from the gadget and just walk, because the serotonin, the happy hormones what we talk about in adults, happens in the child also. And that there is scientific evidence now with progression is reduced from -1 to -2. It might not go.
And this is just with sunlight exposure and playing.
Playing outside.
And if you were to say for sunlight exposure, sir, like you were saying, what is that ideal time? Is it like afternoon time, early mornings? What is it ideal?
I think the ideal time in our environment would be in the evening. Morning there is a huge rush in the house as well as outside the house and traffic. So no point in taking a break in the morning. You can come in the evening, but make sure they are outside playing, doing walking, something in the. So that is very, very. And we have now atropine drops, low dose atropine drops, which we use for
So is
reducing
this
the
a new
progression.
technology that what is happening to reduce the nearsightedness?
Progression,
Okay.
not completely reduce or treat. Progression, I told you, -1 can become -3 sometimes when a jump. When the child birth, growth hormone spurt is there and the child becomes very tall. Suddenly in 1 year or 2 year in adolescence, 18, 19, 17, like that, suddenly the eyeball also grows from the axil length. So that myopia increases. So this, they say, it's proven now. Sunlight, exercise, outside, and atropine drops, low dose, not the regular atropine, which they might not be able to read for 3 weeks if they put for just once. This is low dose every day. So all these are new proven things for refractive error, which is come into the market, and we are for the last 1 year we have been telling most of our patients to follow all this.
So if a child's parent has glasses, then is it a thing that the child also will have glasses?
It is mandatory if the child's parents are -6 and above.
Okay.
Pathological myopia, what we call it as. If both are there, then 100% the children will have glasses. Otherwise, -1, -2, anybody can have glass. It is not that your parent didn't have. A lot of patients come and say, so my grandfather never had glasses. The whole of his life, nobody made him sit in the ophthalmologist chair and check vision. He would have been very bad in distance vision, but he could have read because of -3 or -2 power already inbuilt in him. For reading also, he never knew the glass. And his driving sense and the different things what the new urban adult is doing, he might not have been doing. He was in the farm and he just used to look at a short distance, and when they come nearby, he used to talk. That's all. And so here driving and a lot of other things have happened in the society, which needs precision. So when you sit on the ophthalmology chair, we know exactly which line are reading and we can correlate with what different.
Right. So and next, moving forward to like you were saying, right? Most children don't come back for their prescriptions, but what they do is they go to the nearest
Optical shop.
optical shop. and they say that we have checked it over there and he has said, do this. Is that the right way to go about it?
In children, accommodation plays a big role in giving the glass prescription. That's why less than 6 years we put atropine ointment. That is in first day of summer vacation. Just because 3 weeks I told you drops and ointment work. So they can't go to school. So first day we call them. So put atropine and do refraction. That will be the best refraction for the child. Just going to the opticals and using an auto refractometer, though it is a very swanky, nowadays the opticians are very swanky place things, and doctors are not that in the aesthetic part of the world. We That's why they go first there, and there is lot of things which drive people. An Indian adult like me also, there is a sale when buy one get two free, or and then they give you cards so that the family members also have 50% reduction. All these are wooing them into not seeing their cornea in the slit lamp, retina in the indirect or 90-day examination, and a complete examination only happens with an ophthalmologist, because they are trained to do every bit of it, and we do convergent test. Convergence insufficiency is very common in children also. So we have a pencil push-up test, what we try to tell. Unless we do all this, we will only correct, and that too not correctly, the glass prescription by not putting a drop and getting the prescription. You just give the order, it's 10 minutes job, and sometimes we also take we put drops 40 minutes it takes at least. Now we have better drops of 30-20 minutes we add something else so that we make them, because they become restless in our waiting room. To avoid this, lot of patients and children are taken to the opticals. It's like a coffee shop. Go buy coffee and come back. Here you would have to take an appointment. Doctor is only coming in the evening for 3 hours, and then he has to sit there for 1 hour. No, in our society, the time is the most less. What people don't have is the time. Everything else they will have, but they don't have to even relish their coffee also.
I think that's very rightly said, that most people don't have the time, or I would rather put it as they do not want to take out the time for the most important things.
Most important, yes.
Right. So next thing is that now that, a lot of kids, come back and then they're like, oh, my power grew. I was wearing the glasses, but still, how is it that the power is growing, sir? And this is a common question that they have. So why is that happening, sir?
Yeah. As I told you, the growth hormone increase in the height, all the body parts increase, the axial length increases, this doesn't increase. So when this increases, you say, oh, this thyroid or something is there. Obviously, you see the proptosis But our problem is it increases from inside, the axial length.
So you're saying the eyeball is actually growing while the child is also growing, but from the inside.
Inside, axial length, from the anterior to posterior. So that is not seen by anybody else. And they don't know that this is also growth, and already the patient, if growth happens with the normal pattern, no glasses required. Patient is already myopia. If the growth happens, it's axial myopia. If growth happens, the myopia increases. We don't have any drug or anything to stop the growth. You can't stop any growth of any part of the body for the good being of the body only. Because the function of the body stops when the growth stops. So myopic, already diagnosed, will have a definite increase till the age of 18 to 21. After that, all the growth stops, and then all the myopia stops at that age. That is the time when we take up for refractive surgery and get. To reduce power, it's only resurfacing or sculpturing or flattening the cornea. Glass is just to focus.
Okay.
Then why are we wearing the glass? And I told you, when you don't focus every day, every month, or every year, you've not worn, that suddenly you can't get focus. It's like telling a person who's not walking to run 100 meters in a state level or a national level.
Right.
He can't suddenly get up and run unless he is trained for it.
Right.
Same the eye nerve also. He sees what it sees. If it is focused nicely, it sees what is focused. That is what the glasses do. It just makes the focus as the normal person who's not wearing a glass.
Right.
That is all is the glass work. And we monitor it and change it accordingly.
Right.
But the only thing, patients every time ask, why sir, 10 years, they don't know that they are wearing for 30 years. They always, now the blaming society also blames a lot of things other than them. This happened, that, no, it is some 1,000 kilometers away. No, the spaceship is coming now to world. I think that is the end of the world. That's why this has happened. So they relate a lot of long distance things to their life, and They think that is science. That is
Yeah.
not written in the books.
Yeah.
But to burst this myth, we are here.
Yeah.
So coming to a doctor and doing a good eye comprehensive checkup is a must for anybody.
Right. So then following up with that, right, apart from this, now there are a lot of people online who suggest that do these kind of eye exercises. You will completely, not need to wear glasses only. Is that true?
No, it's a complete false message. I've seen about 1 month back in Pune, urine was, they put their eye in the urine bowl, and then this lady started promoting that in a reel, and but furious my Maharashtra friends were, and everybody came out in a reel who
Yeah.
have never done it before. They said this cannot happen.
Yeah.
This is not a joke. And this is going to be, because the cornea is getting exposed to urine, and urine is not the thing which has to be put. We have tear film, we have tears, the beautiful tears which lubricator, and it will never change any. These are special senses: touch, smell, eyesight, hearing, yeah, all this. This cannot be changed by exercise. No, sir. Can you give me some exercise for my smell? Nobody asks. Is there any yoga for my ear? No. If there is any six packs in my smell, in my taste, there's nothing. All these exercises are for striated muscles.
Yeah.
None of these special organs are striated muscle. They are special organs that cannot be modified by outside exercises.
Right.
That is the simple thing. Whenever people say, "Sir, I rotate my eyes," anyway, you are going to rotate in your life. Every day when you see, you will do all these facial expressions, whether you like it or not. Sometimes, so exercise is for striated muscles who go to the gym, and yoga is for the mental health, and breathing is for mental peace and all this thing. I'm not saying they are not good. They are good for the mental health of the body and for other organs of the body, not for special senses. It is as simple as saying, like, increase my taste, doctor. Can you give me some exercise? What exercise will I give you?
Yeah.
But this is very commonly asked for the eye,
Yeah.
not for the nose or the smell or the taste or the touch or the.
Yeah.
There is no exercise for special senses as far as allopathy is concerned.
Yeah, I think that's a very right message to be put out, because most people go into these things thinking that, I will be able to fix my eyesight
By ourselves,
by
myself.
ourselves. I will be able to, get rid of the glasses and not be able to wear it, and, I will be a better performing person. But in fact, what they are actually doing with what you're saying is that they're worsening their eyesight by not getting it checked at the right
And that
time.
amblyopia keeps becoming dense. Once it becomes light, you can at least try to have treatments. We have
Right.
patching methods,
Yeah.
we have atropine and defocusing lenses, and a lot of other new things have come. And we help it. But once it becomes very dense, we cannot treat amblyopia. And once the age crosses 14 to 16, then the power stays there, same or increase, but your vision will stay there. It will never increase. You will not see 6/6 if you have not worn your glass correctly
Right.
full time.
So, and next thing is that very commonly we see that, once child has reached, and now it's called them adults. Once they reach 18 or 20 years, right, most of them go for a LASIK surgery. Now, what has happened is, especially girls, right, now it's moving on to the boys also, that they are like, now I cannot wear glasses anymore because my face looks very weird. I do not want to carry the glasses, so I will go for a LASIK. Should it be a blanket for everybody, or they have to pick and choose that only these people can do it?
First, the stabilization of power has to be there. You can't do in between. I'm 18 just on my birthday. This is my present given, because it's not covered by insurance and it is a little expensive surgery. That should not be the case. Refraction within 6 months or 1 year should be stable. You don't have any change in your glass prescription. These people are advised to go. Not everybody. There are some. We take more time in analyzing, and these LASIK patients to corneal topography, pentacam, slit lamp, tear bud film. The process takes about an hour and two. And customized LASIK is there now, Smile, Silk, and all these things. That is the most important thing, and that surgeon or who's experienced will tell you whether to go for it, which type of surgery to go for it. And you are not able to, because if there is a keratoconus, a thinning of the cornea, you cannot get LASIK done. So your prerequisite for LASIK in an eye LASIK center is the most important thing. LASIK takes only 5 minutes. each eye. So 10 minutes, it's not like cataract, we do it in different time. We do both eyes in the same sitting. So 10 minutes you are off. But we take 1 hour to topography to match your eye. Now we can figure out exactly which eye, which and how much power can we reduce. We can give them eagle vision. That's the silk. That is a lentule removal. Short lentule lentule removal from the cornea. Before we used to have a flap. When we had epithelium on Lasik, there are some 6 methods of doing Lasik according to the corneal topography. We choose the method,
Right.
and we choose it according to your occupation. If you're driving in the night, some are not there. Some cannot be recommended because the star burst and all is there. So everybody, unless you go to the pre-op room and do all these things, and your doctor, who is a corneal surgeon or a refractive surgeon, tells you to do, then you have to do.
So another thing is, like you were saying in your conversation right now, is that LASIK depends on how the person's profession is and how they are going to utilize the eye accordingly for their profession. So are there different procedures that if somebody is expecting to be working at night, driving at night, versus somebody who's more of a day job?
Yeah. In this pre-operative thing, the pupil diameter in and in the daylight and in the night, as with actually the LASIK armamentarium or pre-LASIK examination and instruments have gone. Now we have half a floor of instruments to use. We sometimes, you will be seeing like a big sheet of a sheet will be put and your patient will be inside. This is to get the size of the pupil in night because the complete darkness. So other instruments are there, the other people who are doing that, but your patient has to the mesoptic vision. So all this, we put a bed sheet in front or a good thing so that we get the pupillary size in the dark. So that much customization we are doing. And if you're a night driving, like there are some people who only drive in the night. They get up at 2 o'clock in the night and start driving because they don't like traffic. And for them also, the pupillary diameter is very important in night light. So that is very important for us to, they can also undergo according, and we plan the laser where it should be.
Right.
And the machine also plans with us.
Yeah.
If you put all these data into the machine tells you can go ahead and do this type of thing.
Right. So, sir, now that you're saying, I feel like there's so much tech in ophthalmology, with an ophthalmologist. What is it that you have seen, because you've been practicing for quite some time now? How have you seen that technology evolve over a period of time?
25 years is my practice time now in ophthalmology only.
This is apart from you being a student for at least 10 years of your life, right?
That is MBBS and all. This is just practice after MS. Huge changes in ophthalmology. Every day there is something new which is happening. Every week there is a new medicine coming in, and every year there is a new instrument coming in for surgery. I have seen my first time. I was in an institute as a senior house officer, the big institute in Tamil Nadu. Then I went for my postgraduate, and that time we had a professor who got out of the microscope. He were never used to microscope because those are new things those days. He got out of the microscope, pushed the microscope, and put an ab external, a knife around the cornea, and cut it open, and then put sutures after you remove the cataract. The microscope is there. He pushes the microscope. I came from the institute where they were already doing foldable lenses, or phaco was started already. Phacoemulsification is the laser surgery.
Yes.
30 years back. And this institute started off like that. They were little less, but now everybody does it everywhere. So from that, pushing the ab externo, ab interno incision.
Yeah.
It's very, very crude. You put a knife and then cut it. Now
In the
it
eyes,
is, it's in the cornea.
Yeah.
One part of the cornea, it goes from 3 o'clock to 9 o'clock.
Yeah, just to make the viewers understand, cornea is the white surface in the eye.
Black portion.
Yeah, the black portion in the eye.
What is the glass watch? Watch glass we call it. The iris is the color to the eye, which is in the behind. The cornea is the seeing portion of the eye. From there, now we have surgeries done by laser itself. We just dock the laser, the Lasik machine, for using it to cut everything in cataract also.
Yeah.
So that is FLACS, what we call as a femtosecond assisted cataract surgery. So that is so precise. 5.5 millimeter incision, um, 3.2 millimeter incision, 5.5 millimeter capsulorhexis. All these are done by the precisely done by the laser, and you slowly remove the patient and do the removing of the cut lens in a different phaco irrigation aspiration canal. That's all.
Right.
Or all the breaking, everything is precisely how many pieces you want. 6 pieces of cataract to be broken, or 8 pieces or 12 pieces, whichever. It breaks, it does the rexis, it does the incision. So you go in with the machine, and then one by one you just have to take it in. So that is a phaco, same technique, but this cut is done by the docked Lasik machine.
Right.
So this is revolution, and in between there are so many surgeries which have come. So this is femtosecond in flax, what we call
Yeah.
it as. And then if it is so precise, we can put a foldable lens, a toric lens, which cannot move, which can definitely. So a cataract surgery itself has become a refractive surgery.
Yeah.
A corneal problem can be corrected by cataract toric lens, and the regular correction of lens power that also be corrected. So post cataract nowadays, people don't wear glasses for distance, intermediate or near.
Right.
We have multifocal,
I think
panoptics.
that's a phenomenal improvement.
Huge.
Because I think just like the kids, older people also forget to wear their glasses, which causes a lot of problems.
Yeah, all the if they're wearing a progressive, they wear it all the time. If they're wearing a reading glass, that will be kept somewhere, and they've been half the time searching for it. And there are more better things they think
Yeah.
they are doing than your glass or vision
Yeah.
or anything like that. Otherwise, progressive glass is also a very big thing, because those days only distance and intermediate. Now we have transitional lenses,
Yeah.
so that people can see all distances according to where they
Yeah.
focus and all these things. So same thing is come to cataract, post cataract surgery also. We make patients no glassware after surgery.
Can you tell me, break down what these progressive glasses actually are?
These are transition power who was already wearing a myopia or hypermetropic glass before 40 years. Once gets the reading power at 40, that is called Charlie's, what people start that reading power because of the muscle activity is getting weaker, the convergent muscle. So they need glasses to read at a 33 centimeter distance. So that is what we are progressive glasses offer. Already the power is there. The top portion of your glass would be for the distance. The intermediate, half of what the reading power is the intermediate distance. So there is a calculation, and that for the laptop and the computer person for the middle of.
Right.
So that's why that angle and that you see from the center,
Right.
and for the reading part, the lower 1/3 of the glass is made of that power, so that you put it at a lower segment and start reading.
So it's phenomenal that one glass actually caters to a wide range of utilities.
Yeah, now the profession itself demands everybody has a computer in front or a cell phone. They have to do a multitasking. Suddenly they have a meeting and they have to see a person they're talking to on the front. So all three has to be, and once you get used to it, it is a very good thing to wear all the time. You will not remove it, because everything is precision and everything is seen very clearly.
Right. I think that's very, very important, because today's age, we cannot keep changing the glasses, like especially elderly. They will wear a reading glass and then a distant vision glass. And it used to be a thing. They used to carry one glass in the pocket and one on their face, basically.
Yeah. And nowadays we have reading in the restroom, we are reading in the library, at a house or balcony. You can't have glasses all around. I have seen a lot of people have glasses everywhere, but wearing a good progressive glass is fair enough. If you drive, you see a cell phone which has come, you stop in the. I am not promoting seeing cell phone when you're driving. Stop somewhere, then you message, then you get back, put it there, and then you start driving.
Yeah.
And there is somebody who's talking just in the intermediate distance, so you can look at them also.
Right.
Yeah, for a glance only.
Right.
And then start. So you can focus on everything with precision.
Right. So now when we talk about ophthalmology as a field, right? I know as a doctor that it is a field that is highest in technology. When we talk about the smallest of the thing, because the eye is such a small structure, and for us to be able to visualize and all of this, how do you see the field expanding? Because earlier most adults would at least see as, oh, ophthalmologist, not so good profession. What do you say about that?
Oh my God. It is evolving every day, and there is a huge transition, like I told you, in instruments or in glass making and everything. Even in this branch, there is complete PhD in ophthalmology. You can do only research. There are some research in Bangalore, where 50 scientists work only with the eye and molecular level and genome therapy and proteomics. And there is so much. Only when you get into MS and that post graduation, you know there are institutes which have pumped in so much crores of money to just have scientists from other and mathematicians just to know. And we have, with permission, we sometimes some can take chimpanzees from Singapore, and we do modeling of that eye, and new technology can be used in them, and a lot of things are happening. It's a huge highway now. Subspecialties come. Now retina is we can have a vitreoretinal surgeon or a corneal surgeon or a glaucoma specialist or a pediatric or then a oculoplastic surgeon. So many diversification subspecialty. Whichever you want, you can take and do. Or a refractive, like a only Lasik surgeon is available. Your onco surgeons are there. Oculo onco surgeons are there. Huge thing in surgery also. And no, sir, but I want to just do niche work of refractive surgery, talk a few minutes and do I have a lot of instruments here. The only thing is you have to build up your practice, and these instruments are not coming at a small cost. Every instrument is more than 30 lakhs. The maximum we have seen an instrument is 6 to 8 crores. All these laser machines and Lasik surgery and smile. That's why they are priced a little higher. Before we used to only cater to sports people and people who are in the cine industry and this film industry and theater artist, and because their profession doesn't need a glass to do. Now everybody wants to look good, and that is good for the society also. And they want to improvise on there, so they don't want glasses. So that is the thing. But taking this profession is perfectly all right. It's a 9 to 4 job sometimes, unless you're on night call sometimes, and that is very rare and few nowadays, because people are taking good precautions of the not having trauma in the house or in the work in the night, so that you do calls are less, unless there are road traffic accidents and mass accidents happening. So it's a perfect, and everything is instrument based, and there is algorithm. Like if you are a glaucoma patient, you have visual field, IOP check, OCT, RNFL, and all this we correlate and see whether the progress is happening, and accordingly we treat. So everything is on the table, and it's all very clean, neat, precision job. And there is no cutting open that, this and all. It's a finger movement only, you do your surgery. It's very quick. Sometimes I finish in 6 to 7 minutes my cataract surgery. I'm sometimes slower after the age is caught up. Otherwise, it was 4.5 or something minutes.
That's brilliant.
Interns used to time it. I don't time my surgery. It's bad for everything. But they said, "What did you eat today?" I said, "I didn't eat anything." "Sir, you did it in 4.5 minutes." I said, "Thank you." After I finish, when I'm in the changing room, I see my interns come and tell that. That was long time back. Now we are not there. We are giving precision, perfect vision. Next day morning, they have to see the last line without glass. That is our aim.
That is phenomenal, because we have seen the field change so much, and it is one field, I think, which is caught up with so much technology, and it's just evolving at a fast pace.
Very, very true. Very true, because we have to, it's like a treadmill we are running. In ophthalmology, it is so true. So many things are coming. The percentage of drops are also changing. So unless you are there in treadmill, we keep running to be in the same place. Otherwise, you will be pushed back. So we are running the race, and we are little increasing the speed, little go ahead and see. Because there's so many things coming in. There are defocusing lenses, which for myopia is a new thing, which it treats progression a little bit. So defocus. So many things have come. And there is research, as I told you, animal or non-animal module, genomic. We have seen the cell, how in the corneal cells, good cell and the waste cell, how it's this engulfs and removes it. Electron. These are videos come out now, and we are seeing all that, and then it's full of excitement. You can do a lot of investigations. A lot of instruments. It's high tech. It's precision, and your patients are more happy in refractive and cataract. Unless in chronic, where in glaucoma and all, patient has to put a drop all the time. They are compliance, and they are little worried, sir. Nothing else to be done. Otherwise, the post surgery or anything, even wearing we have seen children wearing glasses for the first time. And sometimes the parents come back and say, very emotional. They cry sometimes and say, "Sir, that tiles, my son says he can see now the finer part of the tile. He never saw the tile before. He thought it was a white tile. Now he sees the design in it, and he tells me that that itself is a big."
Yeah.
And that when they come and tell us, that makes us even more happy, yes, more worked up to give them even more better for others.
Yeah, I think that's phenomenal, and that's phenomenally important because we appreciate everything with our vision. We appreciate everything with our vision, and it gives us a better way of looking at things. Whether, if somebody is an artist, if that child were to be an artist, right, he would just perform way better in what he's doing.
100%. We have seen that in academics at least.
Yeah,
Artist comes little later, but academics, we have seen people who are not disinterested because of this only, not
yeah.
seeing the board, suddenly becoming very bright and getting involved with all they do, and they fare
Yeah,
well.
I think that's brilliant. So now moving forward in terms of, we have spoken about what tech and everything that you want to do, but I also want to touch upon a small thing about you as a person that I have known you. You are currently the HOD at Ramaiah, and apart from being that, you also do a lot more. That is in terms of your medical comedy and things like that. Even though being such a in a high skilled profession, plus running institution and running an entire department where you are needed to take the call as a captain, how do you make time for all of these other things? And
It is by compulsion only.
huh,
Once the solo practice is becoming a team,
huh,
humor is only one thing which binds most of us, unless you're not touching the sensitive nerve. You can tell them, pat the back and tell them with a small humor. They will do it even faster and even precise
yeah,
and better. I have seen than raising your voice and
yeah,
saying that this could be done this way. Leave them some time, and I think it should not be, oh, comedy means it's a comedy piece, nothing like that. In everything what you do, a little bit of gentleness and a one-liner humor, which will bind, because nowadays human interaction is the most important thing in any field. How you project yourself and how you. And a small humor, I've seen scientists in ophthalmology meeting and huge slides of genomes and database of how the genes and which gene mapping and numbers of the gene and all. Suddenly I go in and I have humor in uniform. They all completely relax, and their thinking capacity comes back once again, and then they refocus. So for scientists itself, it's very important to defocus. I'm not saying whole day you go for a retreat and come back and all these things, but in between there is a coffee break, you do something so that you cheer up the whole crowd, and then it should not be a special part. No, sir, your humor is good. You do it at this from 6 to 6:30. You do now from 9 to 9:30 in the. That should not be. It should come like that. If it
yeah,
doesn't come, don't try,
yeah,
because you're going to worsen it by pulling the sensitive nerve.
yeah,
So I don't know. I had a flat long time back during my college days because of my hostel acquaintance, and a lot of things were happening. A lot of things now also happen, but we take it very seriously.
yeah,
When it happens, it is serious. But later you can go write it and make it a little humorous,
yeah.
and then project it to people. So making the room light and having a group come together and work together, I think one-liners and humors are a part of life.
Yeah, I think that's so important because when you're leading the ship, you need to make sure that your team is with you in it. And like you said, I think it's the best way to recharge our minds to start working better.
Yeah. It's otherwise it's monotonous. It's all numbers and genome, the 13QF, 14FG. That is how they keep talking lines together,
Yeah,
and suddenly they need a break also. This
yeah,
is not like a AI machine which whenever you tap, it's 1 second it comes out. There is a human
yeah,
behind all this
yeah,
research activities. So this helps a lot, at least in the high profile science.
right.
And after about 10, 20 surgeries continuously when you do camp, when you come out and just talk about what happened and
Yeah,
a little bit of spice in normal activities, then it becomes humor and then everybody laughs out. Then you go back and operate once again.
yeah. I think that's a great mindset to go through with life because you cannot be serious all the time. And
Because most of the time we are working.
Yeah.
And most of the time when people say when you're working, even in my office, and you can't have a joke. Oh, tell me a joke now. You can't tell that. It has to come very spontaneous.
Yeah.
I have my friend, I was in the restroom, tell me a joke, excuse me, this is restroom. Because after my show, I go there, some people take selfie and some people, oh, that's nice, can we have one more? You can't have it that way. Even with the highest of the stand-up people, you can't have it.
Yeah.
They have to go in mood and then they have to deliver.
Yeah. I think I think it's brilliant because it's just not the mindset, it's about the mindset that you are in for that space and time, and it has to be a natural thing.
Yeah, you have to cultivate a little bit. And after that, after 20, 30 years of same profession, you would like to wander a little bit and see what other fine arts you can try to do. And photography is one, and a lot of doctors do, and they have to get out of the monotony and the mundane work, and because this is day in and day out, you can't do this with high precision. Because when you are operating, it's like yoga, highest level. You can't. It's millimeter. Your posterior capsule, which holds the lens, is 0.3 micron. If that ruptures, there's a complication. And every cataract has got a posterior capsule there. And that has to be not even touched. So it has to be polished also sometimes. That high precision, you do continuously you need a break too.
Yeah. I think that's very, very important. Like you said, every doctor needs a break and everyone needs to be recharged enough so that their patients can see that benefit.
Yes. Otherwise, cascading phenomena.
Yeah.
Somebody scolded you, you scold your subordinates, and they go home and scold whoever is not wanting to get scolded, but whoever thinks they are weaker, and that goes to the dog and the pet in the house, and that pet goes to. So it is a cascade phenomenon. And if you tell a joke and if you're in a good mood, then you pass it on to the next room where you're going to work.
Yeah, I think that's brilliant. So now moving forward, there's so much happening in terms of technology, and AI is coming to the picture. And how's that changing the landscape of ophthalmology?
We can't prevent AI coming in. We have to merge with it. So a lot of us started doing a lot of things, CV writing and letter posting. We are using chat and everything, and in convocation speeches and all other anything we need an AI now. So we merge with it. But fine arts, like a surgical hands, a fingers, a fine touch, and talk to the patient, and relating to the patient who's coming with you for 10 years. Every year he's coming. So you know better than the AI. What the patient needs and what work he does. And you can have a small 2-liner chat. How's the son? He's in the US. That the AI can't do. Yet, I don't know whether the robots are coming in. But a fine precision surgery will definitely last forever.
Right. So next, moving on to it, now we have so many things happening in the second half of our lives. Like if I were to call it, from your 40s to 50s, again, vision changes dramatically. You have disorders like glaucoma which come into picture. Then you have disorders like cataract which come into picture. And then vision starts to decline. So there we have also this thing called as Vision 60/60. Vision 2020. Sorry, where have we reached on that mission?
Yes, age-related problems like after 40 years, everybody. That's why we say go to the ophthalmologist. They check a non-contact method of pressure in the eye. So if your parents are having glaucoma, you will have a high chance of glaucoma. Like diabetes and hypertension, this is even more twofold.
Can you break it down at what is glaucoma actually?
Yeah, glaucoma is increased intraocular pressure in the eye, which slowly kills the nerves in the retina, the peripheral nerves first, and then you have a tubular vision. All this happens symptomless. Symptomless, there is no pain, watering, itching, no reduce, unless he's a very intelligent, he knows that his side vision is going. So a pressure check is a must. More than 21 and above, this is one of the conditions where one of the pointers for glaucoma. Increased pressure more than 21 mmHg. So that we do that in the and then we find cup disc ratio. When we dilate, that's why we dilate every patient to see the disc, cup disc ratio, the center portion. If we see some abnormality more than 3, then we put them into.
Can you break it down? What is the cup disc ratio for a layman?
Yeah, optic disc.
Yeah.
the nerves from the eye go to the brain. So the cup, the center portion is the cup, and the neuroretinal rim is that. That has to be that yellow center portion. If you see a photo of an
Yeah.
optic disc, center yellow portion is the cup. It has to be only 0.3. If it is increasing, that means the glaucoma patient is getting, and it keeps increasing. And then we have to do a visual field test. So that is a monitor which will precisely tell you the patient's peripheral vision goes, or not that when he perceives it is very late. And regularly doing an OCT, optical coherent tomography, retinal nerve fiber layer. All these are instruments
Yes.
to find out early glaucoma,
Yes.
where nerve fiber layers are injured and there is thinning of the nerve fiber. That is one of the pointers for glaucoma. All these tests can be done only if you go to the eye doctor. So that is very important.
So
glaucoma.
you're saying that damage is happening at the nerve level,
Yes.
and patient will not realize it because he is
It is
not.
very gradual, symptomless, irreversible damage. Damage is okay. Cataract is damage. We give it back. Full vision after surgery, next day only, or one day later. That is okay. Glaucoma is irreversible. What the nerve is not seeing, or it is damaged because of the pressure inside the eye, it is already killed in the periphery, that cannot regrow.
Right.
So
It is like blood pressure, what we have in our peripherals, same thing is happening in our eyes,
Yeah,
but we don't realize it because it
it's a
is very
gradual
gradual
process, a symptomless. Only symptoms drive patients to the ophthalmologist. Otherwise, they go to the optical shop.
Yeah.
If there is redness, there's itching, there's watering, there's decreased vision and pain, headache, they come to the ophthalmologist. This doesn't have any of this.
Right.
That is open angle glaucoma. So that why a comprehensive test at 40 is very important. Every 2 years once test is with an eye doctor is important, because we do all this without your knowledge and tell you are like this, and everything can be shown. All the printouts are given to you. We tell you which is normal, which is abnormal, which is your eye. And then you can easily know where you stand, mild, moderate, severe, or no glaucoma.
So if you were to say one thing for people above 40, you need to visit your ophthalmologist and get these checks done, what would those be?
A normal ophthalmologist will do all this. First, they will do a pressure check and vision check 100%, give you the glasses, dilate. That the cup disc ratio. And most important, that if the patient is diabetic or hypertensive, you see the other parts of the retina, the mid periphery, the macula area where there is fluid content there, and there are tests for that. How much fluid is there?
Right.
So, intravitreal injection has to be given to get the fluid down. So injection into the retina. So all this is available unless we dilate and we don't. Some cases we see the angles of the eye, the gonioscope for the glaucoma. So all this cannot be done. This one leading to another. If the vision is dropped, it's not happening. Then we have to find out why it is not, because of cataract or what is the other, or is the central retina is bad or like that. So all these things has to be. We've got our chart. What all to check in the mind only. So we know this. We have algorithms.
Yes.
So this happens. This patient, this test has to be done. Right. If everything's normal, 6 vision is comfortable, is come next year. That's all.
Okay. So the only important thing, if I were to say, is visit your ophthalmologist.
100%. There is no doubt about it.
Just like how you go and get a blood test done, please go visit your ophthalmologist.
Yeah, most of the retinal condition, outside eye looks perfect. You still having a glitter in the eye. You still have a smile on the face, but inside you're bleeding. The vision wise, a little. They'll tell you, suddenly I saw a curtain coming down. That means the retinal vitreous hemorrhage has happened. They'll tell you the time also sometimes. Macula hole and everything. They'll tell you this. It's like water content. I can't see the central vision. All that we dilate and do OCT and find out exactly how it's a size, shape, what is the treatment next.
Right. So now moving forward, another thing that we see commonly in today's population is most of them are diabetic and hypertensive. But 80% of them will go to their normal doctor and see everything, but they will not visit an ophthalmologist. Why is it important for them to do it?
Baseline fundus examination in diabetic hypertension is a must. As soon as you're diagnosed, your physician tells or not, we have to, ophthalmologists, we tell them, you have to come for a checkup. We take a picture of the fundus and we do all the tests saying it is normal. So every year this has to happen to monitor the retina. Because as I told you, outside it looks very clean. There will be dot and blot ready to bleed. hemorrhages, which we can find out during our examination and laser it before that, or give an intravitreal when there is puffiness of the central retina, edema in the macula area. So all that can be done only if the patient comes every year. Sometimes after we give laser, we tell them to come in 6 months once to see if we need. These lasers are not one time thing, not like Lasik for refractive error. These are lasers which has to be monitored. We have to give more laser, or is it combined with intravitreal, or need a surgery, all that. So 6 months once we call. And any person who's done retinal surgeries, has to go to a doctor at least 4 to 6 months once.
Right. So, as diabetics and hypertensive, what is the most common change you see in their eye which most people ignore and can cause damage to their vision?
Retina. Retina is the most, because there are these are micro arterial veins and everything is getting. This is a angiopathy, which happens in the foot,
Yeah.
in the periphery. Same like that, retinal vessels.
So, basically, you're saying that because of
They're getting blocked.
hypertension and diabetes, the smaller blood vessels in
They're
the
first
eye
getting choked and blocked. And then for recovery, our body produces new vessels. That is not good also, because they don't have tight junctures, pericytes, what we call it as. So that size junctures, like the new normal vessels, are not there. So they profusely bleed. They are making it so that the perfusion of the oxygen to these retinal areas are happening. First there is blockage, there is choroidal non-perfusion zone. That means this area is not perfused by blood, so oxygen is not there. So our blood vessels produce. These are new vessels. That's why we call neovascular elsewhere, or new vessels in the disc. So these, but the bad thing is they don't have pericytes. They are made faster. And so the pericytes and the architecture is not correct. So they start bleeding first. So that before that we have to give laser. And making retina hypoxic area, the less oxygen area, anoxia. Because the central retina is the most important. 90% of the fibers see from the central retina. We salvage all other things so that they don't bleed and detach the retina. Once they bleed, the heme is removed. Then the fibrosis happens between the vitreous and the retina. It pulls. There is a traction between the first layer of retina and the 9 layers.
Right.
So that's called traction retinal detach. That's the last stage. Vitreoretinal tractions, vitreoretinal, all that things are very, very bad prognosis.
Right. So I think the best thing for diabetics or hypertensive is just visit your ophthalmologist once a year.
Yes, that's all.
That will solve most of their issues.
Now we have documented. We give you the photograph of how your retina looks like. And one small dot hemorrhage, with a good camera, we can tell you here 1 quadrant hemorrhage mild, 2 quadrant hemorrhage moderate. It's almost boat shaped and all subhyaloid. Everything is shown in the picture. And we mark it and give it to them.
Right.
So we tell them this is the next visit is according to this.
Right. I think it's very, very essential, because diabetes is something which we are seeing higher in Indian population now. And I mean, the West is already aware. They have all of these screenings in place. But now I think it's more and more important that more people see their ophthalmologist. At least go say hi to them, because then you will be able to see the world much better.
Seriously. And sustainability of vision for a long time.
Yeah.
After doing surgery, it is just removing the silicone oil. You are always on the OT.
Yeah.
Or you're giving injections.
Yeah.
So control of diabetes is important. A lot of educated and urban population also have diversions, like they go to some other, I'm not saying allopathy is the end all and but you should have scientific proofs. For any drug, as you know, we have pages and volumes of research papers published.
Yes.
So according to that only we start giving our patients the benefit. Other branches, if they have this much of publication, this much of research done in so many patients, yes, you can go ahead. Suddenly somebody comes and says urine is good for your eye, soak it in urine. All this looks funny for a doctor like us, but for laymen, but diabetes I've been taking for 20 years, the medicine also is increasing, the sugar is also not coming down. So there is insulin tolerance also. No?
Right.
So they go to other there are so many people who treat diabetes without having a degree or anything.
Yeah.
Just doing. There are good things also there. There is exercise and how to develop and starving, intermittent starving, everything. But a professional should tell you.
Right. So that being said, it's very, very essential that you meet a professional. You meet somebody who's
100%.
aware of your condition and your complication more so. Being aware of the condition is one thing, but being able to manage a complication is something one should be more skilled with.
Yeah, in the last stages, we also can't help most of the time. In diabetic, though, we have burnt our hands in final stages. We can't do. There is a vitreoretinal tractions. There is so many things happening. The retina is getting pulled off regularly, not once. Then the surgery has to happen. Then you have to remove the oil or the gas what you put there, and you can't travel air travel. So many things. So
Right.
as soon as you're diagnosed, you have a strict regime of diet control and sugar and visiting podiatry, nephrology once in a while. I'm not telling don't go because then kidney fails, you have to be in the dialysis room for a long
Right.
time.
Right.
So everything later stage is stitch in time is the best.
Right. So moving forward, the last thing that I also want to discuss with you is that most of the people are now using computers. They're always stuck to their screens. What is the right way? Now there is something called as blue glasses have come in. Now there are red tinted glasses, red film, and all of that. What is the actual thing on
Yeah,
this?
the timing is very important. At one stretch, 20 20 20, that's the rule. Every 20 minutes, take a break for 20 seconds and look at 20 meters distance. You don't have to measure anything. You just have to, after 20 minutes, there are some post-its. Now the computer itself shuts down after 45 minutes. You can do that, half an hour. So that you walk around, that's good for the other parts of, and then look at distance because always the convergent muscle is acting.
Yeah.
So the opposite muscle, this relaxes when the opposite muscles act. So that you give it up. So this 20 20 20 rule is very important for all the professional the BFs. And most of our people are in the computer or in the cell now. Whichever now everything is in, even if you're a surgeon or anything in between, you need to do something somewhere other than the medical part of it. So that is a good thing. And using lubricating, doing a tear film check, saying that dryness. What dryness? Everybody says. But what is the grade of dryness? We have grading of dryness. Accordingly, we give drops, when to put it and how to put it. And just frequently blinking in between work. Think and blink, post, then so that you, so that the tear film completely. We have seen vision drop 2 lines now in regular people because of dryness. Because the debris and everything is collected and they are not blinking. Because the normal blinking is 18 times to 16 to 18 times a minute. A computer professional, because of he engrossed with the work, he blinks only 2 times. That is shocking,
That is shocking.
study.
Yeah.
This came out long time back, 10 years back. But we have to keep telling the patients that you think and blink, take a walk and look at distance. Colors with, but the thing is, and in dull light you should not do anything. The ambience should be, because I've seen people in the night using parents are complaining.
Yeah.
The child is looking at all the light is on because because we are coming and checking them whether they're sleeping. They are with the blanket. They are putting their cell phone. All that is not good.
Yeah. I think that causes,
Sitting posture, everything in a thing. You can't lie down and do because that your progressive glass also has to correctly see where it has to see. When you lie down, the alignment, you don't know where to look at it.
Right.
And the continuous neck strain will be there if you're in different position. So a good table posture when you read like a library or a workplace and do that and take breaks, frequent drinking water, sunlight, all that is very helpful and very much needed, which we don't do it normally because we get engrossed with the work. So this also has to be done.
Right.
And your regular check of glass and diabetic control, if you're diabetic hypertensive control. And visiting doctor once in a year, ophthalmologist is a must.
Yeah, I think that's been a great advice that you have given us in terms of what needs to be done to take care of the most vital sensory organ, that is our eye. Now, when it comes to these glasses, the last thing was those blue film glasses. Are they actually helpful?
Blue block, not big studies have done, but anti-reflection coated was in a rage for 20 years now. Your normal, if you are a branded glass you wear, everything comes in that. Blue block is not a must. Though we need some blue light into the eye also.
Yeah.
So that is very important. You don't have to specify. Branded ones come with the best of the of the coats. So you come with the coat. No extra coats required because a computer itself has got everything.
Yeah.
A high-end computer or a cell phone has everything that light emitting. But for it doesn't mean that you 24 hours work with that. If I put a blue block, so I work more hours. That should not be interval of taking breaks, your timing has to be
Right.
correctly put on paper and done. And sometimes that's it. They said you can't. Life is not
Yeah.
a thing. But the only thing, not necessary for this blue. We have not got huge studies saying that now you all start wearing blue block lens. There's nothing like written
Yeah.
in any scientific paper now.
I think that's a very important thing because most people get sold in these optical shops that this is a premium sell because everybody is selling it to them and they're like, oh, probably this will help because at some point they're like, now my vision is bad, so I need to kind of see what best I can do from now to prevent it.
This
Everybody
blue
is in
block
that.
cannot change a cataract patient.
Yeah.
A blue block cannot change a glaucoma patient. It's not a medicine for that. Nor a blue block is a medicine for laziness of the eye. It is just another thing which without that only we survived 100 years. This is not some suddenly new thing which has come.
Yeah.
And we are living with blue light, all our light with sunlight and all other
Yeah.
lights. So we are much good with it.
Right. So, as a final note, this is very important to tell people that all colors of light is important for us.
100%.
And most tech right now, like you said, comes with its own safety precautions
Yeah.
and everything. So, worry less about blue light and
If
worry more about
yeah,
taking
other
care of your
things,
eyes.
other things. If somebody is pushing you something, that means there is something else other than science in it. If they are saying, oh no, this is the premium thing, this will help you, they don't know anything about it. They are just selling. They are salespeople. They are not they're not medical doctors in the optical shop. So that is very important. So if they are hard sellers, that means it is for their benefit, not for yours.
Right.
But sometimes we have doctors showing you the reports, showing a normal report and your report, which is taken just in front of you. And then he tells that, please try to believe. Non-believing the doctor also is a long
Yeah.
thing.
Yeah. I think
Second
that's
opinion, you can go. That doctor also will have the same machines, same things he'll do, and he'll say, better start early. No more going for third opinion on. Because sometimes people live in, they think this cannot happen to me.
live in
Cataract
denial.
cannot, and nothing cannot. I cannot have this. This
Yeah.
is some, I think this is some new, this is a bogus test.
Yeah. I
You
think.
go to a second doctor and find out
Yeah.
and start as early as possible.
Yeah, I think
Whatever
that's
medicine.
very, very important, sir. As a final note, if you have to give something as an advice to your patient, advice on what are the best practices that they can indulge in for a better, healthier lifestyle.
Patient advice, do your routine things, take care of everything. Don't ex- exaggerate your vices or anything. Don't overdo anything because you want to achieve it. You go and frequent visits. Visits, no, not that every 2 months you go to a doctor. If there is anything, don't go for the shortcut method. Go to the drop medical store, get it, or prescribe from a general physician, because we should see in the slit lamp to see the severity, and accordingly we titrate our dose 6 4 2 1, like that. So that is very important. So titrating the dose, we need to see papillary, follicle, allergy, inflammation, and infection. All are different.
Yeah,
We have machines, and according to our science, we give drops.
yeah,
There's no one drop for all.
yeah. I think thank you for putting that out that there is no one drop for all. Don't go to your pharmacy and pick up one drop and say that I did this and this helped me. Very, very essential because it is your vision. It is not just another sensory organ.
We also sometimes live in denials, that word,
Yeah.
denials. Very important. Patients say, no, sir, I can't get it. No, none of my family can get it. Even if you put the list of tests what you've done and you detail test what they have, still let them go for second. I'm not saying don't go to a second doctor. Go to a second doctor. Once it is confirmed, second doctor, no more loitering around and wasting time. Because time is precious even in treatment. Earlier, the better.
Yeah, I think that's very, very right. Time is precious, especially in treatment. And I think it's been an engaging conversation
Oh,
with you,
thanks.
sir, because we have had so much insight about eye health that most people need in today's day and time because there's so much misinformation that's been going around and doing the rounds, and people think that is the right information. So, thank you so much for
Thank you
your
very
time.
much for having me here. It's a pleasure
Yeah,
to talk about science
yeah.
and little bit of comedy also, which we couldn't do much in our talk. Yeah, But everybody has to live life fully and without
Yeah.
disease.
Yeah.
That's what our aim is.
Right.
Right.
I think that's a beautiful thought to end with.
Thank you.
Thank you, sir.